Hi, Scott.
Hey, Dr. Alex.
All right. So thank you for agreeing to talk about the procedure that you had for enlarged prostate. I think you had a procedure a few years ago. You came to see us in 2020, right?
Yes.
And had surgery back then. Can you tell me a little bit why you came to see me? What kind of symptoms you had?
Sure.
What kind of treatment you had before coming to see us?
Yes. It had been building up probably since 2017, maybe. I travel a lot, and I always felt like I had to pee. I had to relieve myself, and I would go, and there'd be nothing really coming out. It was always a false alarm. Getting up 3-4 times a night, a very uncomfortable situation to have. And that's why I came in, because it got to the point where I needed to do something. And so you had, after doing the testing, realized that I wasn't eliminating all the urine in my bladder, and suggested the laser TURPs, and major success, and pretty easy procedure as well too. I mean, really no discomfort. It was quick, and the results were amazing.
How long did you stay in a hospital after the procedure?
I want to say 4 hours.
So you went home the same day?
Went home the same day. I think I had the catheter in for one night, and it was easy.
Okay. So you had actually what we call laser prostate enucleation with holmium laser. And that was 5 years ago, right?
Yes, 5 years ago.
Now, before you had this surgery, before you came to me, you had another procedure, right?
Correct. I went to a local urologist on Staten Island. He did the procedure, which was not, I'm trying to think what it was.
Prestiva, it's called Prestiva.
Prestiva, yeah.
Right.
That lasted about 6 months.
So you had some benefit, but it didn't last long.
It was not worth what I had to go through for something 6 months. Night and day from what you did.
Now, you also tried medications, right, before having surgery?
Yes. I did the Flomax.
Mm-hmm. How long did you use Flomax for?
2 years.
Did it help you?
It helped a little bit, but it also had side effects, which I didn't like.
What kind of side effects did you have?
It's hard to describe, but for me, I think there was some maybe joint pain associated with it or something. But compared to the surgery, not great. And also, I'm not a person who likes to take pharmaceuticals.
It's hard to get adjusted from not taking medications to taking them.
That's correct.
Sometimes.
Yes.
It's hard to remember to take it every day. That's true.
So when I travel, don't have to think about it. Mm-hmm. I'm good.
Now, you mentioned that, before you had prostate enucleation, you were waking up 4 or 5 times a night. How did it affect you?
Lack of sleep. Being irritable. Sleep is important. Since the surgery, I get up once a night, and it's a miracle.
How's your urine stream since surgery? Has it improved 10% better, 50% better, 90% better?
I would say it's probably 80% better. It's like when you were a kid.
Okay. You can shoot to the other side, right?
That's correct.
All right.
That's correct.
Now, overall, how has your quality of life been affected by having the surgery?
Nobody wants to have urgency to urinate all day long. You might be driving on a trip. You might be in an airplane. It's a drag to have that problem. Since I've had the surgery, I don't have to think about it anymore. It's positive.
Great. Did you have any complications after surgery?
No, not a one. I followed your directions, and it was easy.
Typically, after transurethral surgery, where we don't cut your belly, but just go through the urethra, some people have irritation, urgency to urinate, some blood in your urine. Do you recall how long have had urgency, frequency, blood in your urine after surgery?
I think maybe once after we pulled the catheter out, I had a little blood. That was it, and no pain.
Okay, that's wonderful. What would you recommend to men in your situation, who are in your situation where you were 5 years ago? Would you do the same procedure? Would you do it in a different way? Would you do a different procedure?
I'm glad that I went forward with surgery, because I know that a lot of men put it off and they are afraid that they just take the Flomax. I would say the longer you wait to putting the surgery off, you're giving away your quality of life. So, I'm a big get it over with fan.
Yeah, I think a lot of men that I operate on or that I treat, put off surgery for a long time, but I think once your symptoms become severe enough and pills don't help, sometimes, surgery provides the best solution.
Yeah, I agree with that 100%. Yeah.
Any other parting advice?
Dr. Alex's office is great. I like the staff, and I always feel like I'm in good hands.
Well, thank you. I appreciate it, and I think my staff appreciates it as well. I thank you for your willingness to share your experience, because it's confusing. A lot of people tell different things. People have different experiences and different concerns, and hearing it from someone who has gone through it sometimes answers a lot of questions and provides some reassurance to people who are facing the same problem.
Yeah.
I appreciate your willingness to share.
My pleasure. My pleasure.
Thank you, Scott.
Okay.
All right.
Well, hopefully that helps.